Okay, introduce your journal.
Okay, we're gonna do the first journal article, tiotropium versus salmeterol, all right?
Mm-hmm.
We're going through the background. It basically talks about COPD and other studies that they've done before comparing tiotropium to salmeterol. But for whatever reason, either they weren't designed right or they weren't powered to detect a certain exacerbation, right? So this article, what they're trying to do is compare each one, tiotropium to salmeterol, to see which one goes first in a severe exacerbation in COPD. Make sense?
Yes.
Yes, everyone agree?
Yes.
Okay. So, in the background, do you guys see the primary objective stated?
A comparison of two active treatment groups is in line with recently growing prevalence of comparison effectiveness. They want to see if it's more effective, meaning superior to what to salmeterol.
Okay, but usually it tells you, like, our aim is to do this, or our primary objective is to... From what I saw, I don't see it clearly stated in the background like other articles have it.
But they're not
Later on, it'll tell you about the primary endpoint being the time to the first exacerbation of COPD. From that, you can deduce what they're trying to get, but it doesn't clearly state it anywhere.
They're not necessarily going to tell you straight out.
But we can,
Yes, so
from all the information.
it's not clearly stated, but you can deduce it pretty much. Primary objective, not clear. All right? So the first primary endpoint is time to exacerbation. Right? So this is primary endpoint. So in the methods, they did a 1-year randomized, double-blind, double-dummy, parallel group trial, 725 centers, 25 countries, to compare the effect of tiotropium with salmeterol. So it's just a comparison of two different things. It's not superiority, it's not equivalence, it's not non-inferiority. They're just comparing two different ones. Do you guys agree with that statement?
I think it's a superior. You want to see if tiotropium is superior
Yeah,
to salmeterol.
that's what I thought.
You want to see that it's superior to it. That's what I think.
So everyone thinks it's superior then?
Walter, what do you think?
I haven't read that one.
Objective to the group and the superior.
Yeah, that's true,
Where
because
does
they
it
say
say?
that, it says, the guidelines right now don't really state if one is better than the other.
Right.
That's what they're trying to do.
They're
That's
trying
even
to-
that's the
article.
purpose of the article.
There's even that hazard ratio thing that says the analysis of the primary endpoint, and isn't it determining like the superiority, if it's superior or not? Like if tiotropium is? No.
So it's to determine if one is superior to the other.
Okay, that's what you're saying.
Okay, so...
Why do you think Dr.
Look, I don't
Garcia?
have all the answers.
We're not too
We're
far
just here to
off.
discuss it. I don't-
She's not gonna tell
What do you think, Dr. Garcia?
I know.
I know you know.
Who's on the right track?
Did we go off the road? We're okay?
Decide,
So
it's okay.
superiority.
It's a superior because we're going to see if salmeterol, because they've done testing before to see.
So does it clearly say...
It isn't clearly stated, but it's like you're inferring what they're testing, because they're telling you they've done testing before, but they've never been able to like 100% say flat out, oh, one is superior to the other.
Because of
Okay,
limitations
so
to studies before.
In a superiority trial, you usually have a standard and then something else coming in compared to that standard to see which one is superior. Which one is the standard here?
Both of them are kind
Both of them are used and they don't know which one is better, so they're trying to see which one is better. But they're not saying, here, salmeterol is the best thing and we're going to see if tiotropium is better.
Right, they're
That's what I
comparing
see.
them.
I mean, that's why I think it's a comparison.
I don't know.
Dr. Garcia? She's rolling
Well,
her
see,
eyes a little, I guess she
I know she
doesn't
doesn't
agree
want
with
us to,
that.
I know she doesn't want us to use this, but if it goes back in the abstract, I'm just going.
Do
I know
not
she
use the abstract, next. Do not, it will not be in the article for the final, do not use the abstract.
Okay.
That's confusing too, I know it says superiority.
So compare.
So, the fact that there's no like standard
it's a
comparison, does that
comparison.
mean it can't be a superiority trial?
I'm reading,
Yeah,
well,
but she doesn't want
I
us to
think
use that.
it's comparison.
Yes, no?
I think it's a superiority, but,
But then which one's the standard, like you said?
From the slides in
Okay,
class.
if it is a superiority, right, you need to have a two-sided
it is two-sided.
intention to treat, right? That's what you
Correct.
need in order to determine superiority.
That's what they started out with.
Okay, well, we'll get to that later, but we'll just see.
Okay.
So right now, we're not 100% sure, for the most part, are saying we think it's superiority, but yes, no? Dr. Resi?
You're having a good discussion.
Okay.
But it's two-sided.
It is two-sided.
So
But
is it
also,
gonna be both?
but also equivalence is two-sided.
No, I'm saying like, we have two sides of an argument.
Oh, okay, but no,
I'm not getting like technical here.
Oh.
All right, so they're looking at moderate and severe exacerbation of COPD in patients with moderate to very severe COPD, right?
Okay.
Let's skip down to the endpoints. They get a lot of confirmations from different places.
And your secondary endpoint.
First, the primary endpoint, we already talked about, first exacerbation of COPD. Then, secondary and safety endpoints included time to event endpoints. So, secondary is time to event, right? Number of events. Serious adverse effects and death. Do you guys think that these secondary endpoints are good predictors of the primary endpoint, which is what we're trying to see? Do these correlate?
They
Does it make
correlate.
sense to look at this in order to try to determine that?
Yes.
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 Yes?
Yeah.
Yes.
Okay. So they define what an exacerbation is. Any questions on that?
No.
No.
All right. Inclusion, exclusion. Inclusion, you have to be at least 40 years old, smoking history, diagnosis of COPD, different lab parameters of breathing.
They were appropriate.
Everyone thinks they're appropriate?
Yeah.
Okay, well, I honestly don't know enough about COPD to say otherwise, so.
Yeah, from.
You have an expert
Appropriate.
in the room now.
Can our expert speak up and confirm?
Sure, looks just fine.
Okay. Exclusion criteria are in section 6 of the supplementary appendix. Okay, somebody asked me, the supplementary ones that are not included, they're not gonna be in the final, so we don't need to.
What kind of craziness have I pulled this semester that makes you think I would
We
test
just
you on
looked at your
something
notes.
that would not be in
So
front
you're
of
not
your face?
expecting us to go on our own, look at the supplementaries, and then come back
No,
with the
and
final?
I actually said that in class.
Okay.
Anything that you will need,
No.
you will have. Anything you will need, you will have. And I wouldn't make you guys go look for the supplementary. If I wanted you to have it, it would have been posted.
Got it.
Got it.
So you can deduce what you want from that.
So the exclusion criteria is fine if she's not giving it to us. All right. Next, the procedures. A 2-week run-in period.
What's a run-in period?
I don't know what that is. What is a run-in period?
Oh, crap. All right, flip the board. Is it white on the back too?
Yes.
Can it be written on?
Yes.
Unlock the brakes of the wheels.
This?
The wheels, the things that are round at the bottom, like on a car. There you go. Just easy.
I think it's this one.
Okay. All right, so you have a study, right? What do you know happens in the course of a study?
They do testing, pre-testing.
Okay, so before that though.
They
Enroll
recruit
you.
patients and enroll.
Okay, so we recruit and enroll, okay? Now, if you want to bring everybody to the same level, right? So if I know that you take a drug and you take a drug and you take a drug and you take a drug, but I wanna see the effect of our drug,
You need like a washout period or some sort.
right? So what do?
Oh,
We bring everybody to zero, right? So this run-in, right, is also like a washout, right? So you have a run-in, and what it can do is it gets everybody put back to the same starting point, the same 0, or if you wanna start them at 5, whatever, right? So you get them to here, which means you run in, right? So part of this is gonna be, you wanna see if they're gonna actually stick to the therapy, if they're gonna do what they need to do, right? So you run them in. It's like tryouts, right? And if you don't make it, you're not gonna play the game, okay? So you're running them in, you're getting them to this point where you can start and either randomize them to one arm or the other, right? So your run-in is that. Now, what is a washout?
It's like when you're doing a trial in between the trial, like if you're gonna switch
A
over.
crossover.
Yeah, crossover trial.
Right? This is your washout.
Oh, so the run-in's not a washout?
They basically do the same
It's like a
thing,
pre-washout.
right?
It's like a pre-washout there,
Uh,
for the
so
treatment that they had before.
You have to get them to the same place, right? You run them in, you make sure they're gonna do what you need them to do in the study, and then you start them, right? So let's do like this, okay? You start them on one or the other, and then you wash them out, right? Because you wanna see if the other person responds to treatment A or treatment B, right? So this person starts out in A, they get washed out, and then they're gonna be exposed to B, and we're gonna measure this to this, right? So the washout occurs here, the run-in occurs here. But they do the same thing, they bring you back to 0, right?
But this one only had a run-in, right?
You tell me.
I don't get, yeah, that's the thing, I don't get why they give placebo plus the drug for both,
So
both groups.
Why would they do that?
one is like BID and the other one I think is like QD or
What I
something,
didn't
so-
understand is why ipratropium was switched to, why tiotropium was switched to ipratropium, which is 4 times a day,
Yeah.
which is more of a rescue thing, and the beta 2 was just all the way through. Oh, you stay on it, continue.
Yeah,
Why is one being discontinued, the other one?
I didn't understand that, I didn't understand why they both got placebo.
Standardization.
That what you were telling me about the,
So it is a superiority trial.
I
Of
am
tiotropium
just
versus
letting
this.
you know that COPD has a standard treatment, right? A beta-2 agonist is rescue therapy. And the standard of care is that in a COPD or asthma, World Asthma Day, okay? You have to have a rescue inhaler.
So you can't take it away.
isn't that what you're saying about the same class effect or whatever, that's why they switched them
Now.
over
TO,
to wash them out? Oh, so it was a
tropium,
washout.
is what?
A long-acting anticholinergic. A short-acting 4 times a day.
Okay? What is the drug you're trying to study?
Tiotropium. So they're doing a washout.
So this run-in that they do, right, is saying what? If you wanna test this drug, can they be on it when they start it?
No. But you
So
also can't
you
take them off something.
Run them in and get everybody back to zero because you wanna try this drug and you wanna try,
Salmon.
Something.
okay? So in order to test this drug against this drug, they can't already be on this drug, right?
But it's unethical to take them off of something because
They need
They
something,
need
something. So you're
right?
putting it
So
in-
these are the same class. One is long-acting, one is short-acting, so you're just giving them something, just not the drug that you wanna test.
Something
And
to
so
keep
you-
them over until you start the study.
Right,
Oh,
so
so
you
that's
run
a
them in and you
zero.
get everybody back to the square zero, right? You get them back to the starting point and then you put them on therapy. And one of you guys mentioned something about the drug. Why are there two different drugs that they're taking? Tell me why.
So
Huh?
it's the same amount of times a day, we don't know the difference between one and the other.
Okay.
Oh, one is BID, I think it was, or something like that, and the other one was only like once a day or something.
Yeah, some Adderall's twice a day and the other one's once. But you have to give the placebo, not a placebo, but one of them's once a day, the other two times you get
They don't know which
Right,
one they're
so they don't
taking.
figure it
Right,
out.
so they have to make
basically.
sure.
And what is a super fancy name for that?
Blinding.
Blinding.
Sounds like schmubble, schmummy.
Double dummy.
Double dummy.
Ah, that's what that means.
Okay, so let's go down in procedures. Towards the end, it says patients who prematurely discontinued treatment were followed for vital signs.
They didn't evaluate adherence in the trial, wouldn't that be kind of important?
Adherence was not systematically assessed during the trial. So, question mark, what do you guys think?
Is that insignificant?
Like I said, I don't have all the answers, so. What do you guys think? Yes, no, maybe,
I don't know.
move on.
Move on.
Yeah, I don't know.
Okay, a little further down. Patients who prematurely discontinued treatment were followed for vital signs until the end of the planned treatment period of 360 days.
Should they include it then?
Okay, information on vital status was considered to be complete for patients who attended all trial visits through the 360 days, and for those who prematurely discontinued study medication, but whose vital status was confirmed at day 360. What does that sound
That's
like to
last
you?
observation.
Last observation
Everyone
carried
read
forward,
it.
right? So that kind of sounds like salvage.
Yeah.
Is there a better mark?
Mm-hmm. Mine are over there.
But they don't say the words.
If they don't say it blatantly into your face, it can't be.
Probably they're trying to mask it, like, okay, we're doing good so far, so.
I
Yeah, 'cause they're not
underlined it because I
gonna
wasn't sure.
Go out and tell you that. Because
Not
then
something
it's
they wanna-
like mess up
They're
the
not
trial.
proud about.
Okay, so
Yeah.
salvage,
Kinda
right? Yes?
Yes.
Next, statistical analysis. We estimated with a sample size of 6,800 patients. So N equals 6,800. Right? 3,400 in each group. It would be 80%
That's low.
power to detect 10% reduction with TO versus Salmeterol versus cell. Yes? They used two-sided test, which is here, for the null hypothesis of a hazard ratio of 1 with alpha 0.05. We're good? Okay, next paragraph says the efficacy and safety analysis included all the patients who underwent randomization and who received at least one dose of the study medication. So that means it is modified intention to treat.
So, this is where I'm confused. So since we said that was last observation carried forward, correct?
What was?
The data?
The whole thing.
No.
Or,
The vital sign, the vital status.
Oh,
So the vital status is not your primary, this one here.
but you're using the vital status to determine.
what does vital status mean?
Your blood
Life.
pressure, your.
You're not dead.
No.
Yeah.
Vital status means you're not dead.
Okay.
Is that time to exacerbation?
No.
Okay.
All right, so remember, we're using modified intention to treat. Everyone agrees?
Yes.
Remember, for superiority, you need to use intention to treat. Yes?
Yes. Yes.
Do you
but
see
yeah.
a potential disconnect?
Yes.
If we're determining that this is really what's going on, right?
Yes.
Does this make sense, Dr. Garcia?
But if it's a modification, is this still considered intention to treat though?
Hmm?
It's a modification of intention to treat.
What are you talking about?
For superiority, you need two-sided intention to treat. Correct? Your test needs to be, but the people they're using is modified intention to treat. It's modification.
What did I tell you guys about articles and their intention to treat versus modified intention to treat? What do you know versus what will they do?
You're not gonna tell us.
They will use one when they should be using the other.
Got it.
They will use one when they should be using the other.
So even though they use MITT, it should be ITT.
It should be actually
Correct.
ITT.
So that is a deficiency in the study that you can critique later if you were actually doing a journal club. Make sense?
Yes.
So we're not doing that, so let's move on. Next, primary and secondary time to event. Endpoints were analyzed with the use of a Cox proportional hazards regression model, including terms for pool, center, and treatment. P-values were calculated with the use of the Wald chi-square statistic. P-values,
Wait, you skipped, did you do primary and secondary time to event endpoints were analyzed?
yeah.
Okay.
So p-values using a non-parametric test. And what are the p-values referring to here?
I think that's just the statistical tools that they were using.
Yeah, but you
Understand.
need to use the right statistical tool for the data.
Do you have p-values in the subgroup analysis?
I'm sorry, the what analysis?
The secondary outcome distraction.
The subgroup or secondary?
Subgroup is that?
And what do you know about subgroup?
Garbage?
Not always. How do you know if it's garbage?
Oh, if they don't mention it in the methods, then it's not gonna be beneficial. You can't use it. It's not gonna be great data, it's gonna be salvageable. So I don't,
So don't get lost, don't get lost.
Is
Go
that
back
like
to
the-
where you're at.
The mirror image.
should they mention the methods though?
So if
Okay.
it's
Then you do
here,
subgroup
it's
analysis.
here.
Okay, so the methods mentions that they're doing subgroup analysis, and the results also talks about it, right?
Yeah,
Okay, so that's good.
but we need to we need to see the.
I'm just trying to determine, are you using the right test for the data?
No.
No. Why do you say no?
Well, I'm thinking it's ratio and interval data, and we're using a non-parametric test.
So time is interval, right?
Yeah.
Time equals interval data. One question I remember they asked me, like number of hospitalizations, is that interval, ratio?
It's
Number of
a,
exacerbations?
it's a number, right? So it's something that, number of hospitalizations, right? Is that the time that you're in the hospital or the number?
Quantity, right.
So what kind of what kind of data is that?
Ratio.
Ratio.
No. What is ratio?
Oh, lab values.
Right, okay?
But not-
Nominal?
If it's
So if it's not a lab value, it's never ratio.
that would be safe for you guys right now, okay? So if I tell you 3, 5, 7, 12, that's the number of times in the hospital, right? If
So
I
that would
said
be-
3 days,
Wait, why not? Would that be
12
ordered?
days,
Order no, because they're
Because
saying.
3 is less than 5.
but are
6 is
you
more.
comparing 3 to 5? Or are you saying how many
It's
days?
either
Just
3
how many
or
hospitals.
5, it's like that.
It's like categories.
Okay,
It's not-
so
Yeah.
when you think about time, right, when it's an interval, you're looking at the length of the time, right? If you say how many times did you go in, you either went in 3 times, or you went in 5 times, or you went in 12 times, right? But if I talk about the length of your stay, that becomes an interval. If I ask you how many times you went in there, it's how many times, right? If I said the number of times that you go in has something to do with how severe your disease is,
And it's ordinal.
then it becomes ordinal. Because if I say 3 is less than 5 is less than 12, and the more you go in, the worse your disease is, then it becomes ordinal. If I'm asking you how many times did you do it, what's your category, then it's a category. If I relate it to something being better or worse, or there's some sort of ranking or level, then it's ordinal. If I'm asking how long of a time you spent in there, then it becomes
Interval.
interval, right? So that's how you can separate that it goes in there. So you have, not only do you have to know, they said something about time, but you have to know what it is that they're saying so you understand exactly what that data is. So now, what kind of parametrics, non-parametrics would they use?
They're using walled chi-square, which is non-parametric for nominal.
But you're
Well,
missing
for
the
this-
first part of the sentence though. Primary and secondary time to event endpoints are analyzed with the use of a Cox proportion hazard regression model.
Okay.
Right, because it's what?
So they're measuring time to event.
Right, but this, he's talking about,
This was like a separate question somebody had asked me to bring up.
Oh.
But in terms of this, the primary, secondary, the time ones, Cox proportional hazards regression, is that good? Yes or no? Does that make sense?
I don't-
Data to test.
I mean, it's saying that it's a regression model, so you're looking at a relationship between the time. Relationship between two things. But I don't know.
do you guys need regression? Okay.
No.
No.
You want?
Move on?
So then it's insignificant, so we agree that the test is not appropriate?
So
What is the test?
The chi-square.
Okay,
And Kaplan-Meier that they're using to.
okay. So
analyze.
which part is the chi-square measuring?
P-value.
Okay, is that appropriate?
So P-value is for the primary and secondary endpoints.
So it's a difference, right? What is chi-square measuring?
Like non-parametrics.
Non-parametric.
Okay.
Well, at time, everybody agrees that time is an interval data, right?
Right.
Well, time to the event, right? Time to the event is an interval. And what are they measuring?
Time to exacerbation, time
Mhm.
to an event.
Okay.
Those are interval, and they're using
A non-parametric.
a non-parametric chi-square to measure this.
What is the other thing that they're using?
Kaplan-Meier?
And what is Kaplan-Meier?
Time to event.
That part is appropriate. But it's cut square?
But there's a reason why, because you guys the regression piece is in there, right? So read that section.
Primary and secondary time to event endpoints were analyzed with